And for those of you, I think most everybody here knows me already. I think Kayla, you're maybe the only person I haven't met before. So just to give a quick introduction, my name is Keyne Law. I'm an assistant professor over at Seattle Pacific University, and in 2 more months, associate professor over at Seattle Pacific University. And I'm also an affiliate assistant professor at UW, and also a Methodist Core faculty member in the UW Suicide Care Research Center. And so today I will be giving a talk on the TikTok study that I have been conducting over the past year or so, which is funded by the Garvey Institute of Brain Health Solutions Innovation Grant, and kind of walking you all through some of the preliminary findings from that study. So thank you for coming today, and I will let myself take it away. All right, let me share my slides real quick here. Can you all see my screen okay? Yeah, cool. All right. Let's see here. Make sure I maximize so I can see everybody's faces, because I hate presenting without seeing people's faces, because then I just don't know who I'm talking to. So let me just do that real quick. There we go. All right. So, like I said, today I'm going to be talking about some of our preliminary findings on TikTok's impact on young adult mental health and suicidality, using some insights from both user perspectives from qualitative interviews, as well as some of the TikTok data that participants have given us permission to analyze. So first of all, let's talk about why TikTok is important to look at. TikTok has been the fastest growing social media platform in the United States, and really kind of explosive growth since 2020, when the COVID pandemic started. You can see that little slope there in pink, which shows the growth of TikTok. And this is just kind of growth up until 2023. We can kind of project kind of further growth after 2023 and into 2024. Approximately 150 million individuals in the United States are monthly active users on TikTok. And again, this is a number from February 2023. We can expect that number to be much higher at this point. I believe the most recent number is probably around 180 million monthly active users in the United States for TikTok. The United States is the leading country with the highest user count for TikTok, and about 45.3% of social media users in the US use TikTok at least once a month. And an average TikTok user spends more than 1.5 hours each day on TikTok. Now, the Pew Research Center suggests that each of us have about on average, 5 hours of leisure time a day. And in that leisure time, we think about this, 1.5 hours are spent on TikTok. That's more than a fifth of our average leisure time spent on TikTok. And more than 1 billion videos are being viewed on TikTok every single day. The majority of users in the United States for TikTok is between the ages of 12 to 24. And I'm going to kind of show you guys this video here to kind of give you an idea of what the TikTok algorithm looks like, because it's the content recommendation algorithm on TikTok that's really kind of concerning, because it can really quickly get you into a rabbit hole of certain content that it thinks you want to engage with. So this is how the algorithm works. Can you all
hear? This is a visualization made from hashtags attached to the videos our bots watched. Think of it as a partial view of the universe of TikTok content. Here's where we found dance videos. Over here are the cooking videos. The spindly arms stretching out of the center represent niche content areas. This arm starts with general videos of cute animals. But if we follow it out to the end, we find more specific videos for enthusiasts of French bulldogs.
So it's kind of shows you how these TikTok hashtags are kind of networked together, and why kind of this content algorithm kind of get you into these really kind of niche areas out on these little spindly arms that they're showing in this diagram over here. And so what does that mean for mental health? There's been increasing concern that like other social media platforms, TikTok content can increase mental health difficulties and suicide risk, especially in adolescents and young adults who are particularly invested in the app or spend a lot of time on the app, and also kind of potentially more susceptible to some of the messaging and influence of social media. Now, again, the content recommendation algorithm for TikTok is what makes TikTok particularly pernicious compared to other social media platforms. And so you can see here 2 articles that were kind of recently published on how people are thinking that TikTok impacted their child's suicide death, and how TikTok kind of contributed to their child's depression and mental health symptoms. So the purpose of my study was really to understand how TikTok use impacts mental health in adolescents and young adults. And specifically, I wanted to understand how adolescents and young adults perceive TikTok's impact on their mental health. Because I think a lot of adults and a lot of people kind of often come into this space and they're like, no, it's bad for you. But it's when I talk to adolescents and young adults, there's a different opinion there from the actual users themselves, because I think oftentimes there are certain age groups that may be less on TikTok, right? We saw that most of the users are age 12 and 24. And we can imagine a lot of researchers, a lot of clinicians, and a lot of people making policies are well above that age range. And so I wanted to understand from the user's perspective what's going on and how they're using TikTok and how it impacts their mental health. The second thing I'll talk about today are some of our preliminary findings around certain patterns of TikTok use and how it's associated with increased suicidal ideation, and whether or not age and gender also influences these relationships. And so I'll talk specifically about social connection as well as social engagement. And just because we are all researchers, or a lot of us are researchers, I'm sure some of you would also want to know, how do participants actually feel about sharing their TikTok data for research? How feasible is this work? And so we'll have a little bit of bonus content here on some of our participants' perspectives on sharing their TikTok data with us. So just to kind of give you an idea of what our methods look like. So participants were recruited from Seattle Children's Hospital and the UW Outpatient Psychiatry Clinic, as well as the SPU University campus, a lot of the college campuses, as well as the UW campus. And we also flyered out in the community and also connecting with different high schools to kind of recruit those adolescents. We specifically were looking for a sample that was made up of 50% of adolescents, 50% of young adults, as well as having half of each of these age groups have a history of suicidal ideation. So to give you an idea of who is in our study so far, because this is an ongoing study, in the sample that I'll be talking about today, we have a sample of about 104, and the mean age of our sample is 20.49, range being between 16 and 25. Still kind of struggling to get those 13 to 16-year-olds in, and so we're still kind of recruiting and looking at summer camps now in high schools to kind of get those folks in. In terms of gender, about 78.8% of our sample identified as either cisgendered or transgender female. 14.5% identified as cisgendered or transgendered male. 4.8% identified as non-binary, and about 1% identified as genderqueer, and 1% identified as agender. In terms of the racial composition of our study, about half of our sample is white, and 26.9% were Asian American. And then we had some smaller proportions of other race and ethnicities represented in our sample, but predominantly white and Asian American. As I mentioned earlier, we were kind of intentionally trying to recruit at least half of our sample with a lifetime of suicidal ideation. But taking a look at the past month, about 15% of our sample had past month active suicidal ideation, and about 43% of our sample had passive suicidal ideation in the past month. So we had a lot of folks who have active or have current thoughts of suicide or current thoughts of wanting to be dead. The lifetime history of suicidal ideation in our sample is about 61% for active suicidal ideation. So our sample has gone through a lot, even if they're not kind of experiencing active or passive suicidal ideation right now. All right, so after they signed up for our study, they were scheduled for an interview. And in this interview, we went through the SIQ Junior with them to measure suicidal ideation, the Columbia to measure history of suicide attempts and behaviors, and then the CIPI-R to measure history with non-suicidal self-injury. And these measures were largely selected because this is what we thought that we were going to be using in the SCRC for a while, and when the study launched. And so we were trying to stay consistent with the measures in the SCRC, but we have now kind of switched out the SIQ Junior for the HOS and SCRC. So the SIQ Junior made sense here because we were going more for a younger sample. We also had some open-ended questions that we asked our adolescents and young adults in this study, where we had them kind of explain to us how they think TikTok is impacting their mental health, their peers' mental health. We also asked them some questions about what's feasible or what's acceptable to them in terms of intervention when it comes to social media interventions. If let's say TikTok were to discover, was to kind of get this idea that they may be having thoughts of suicide. So after their interview at the end, the interviewer then kind of helped them request TikTok, their user data from TikTok. And these requests usually take about 3 to 4 days to process. And so about 3 to 4 days after their interview, we sent them a reminder to download their TikTok data. And then a few days after that, which is exactly 1 week from the date of their interview, we sent them a follow-up survey where they kind of filled out the SIQ Junior again, alongside some other follow-up questionnaires. And they were kind of guided to look at and upload their TikTok data. So these were kind of the procedures that we took to gather all of this data. So let's first look at some of the qualitative findings that we had. And I kind of started off with this quote just because I thought it was really sweet. What this participant said: sometimes my For You page has a message like, "Hey, I'm glad you exist," which is pretty cool and heartwarming. And this is an 18-year-old Asian female participant with no suicidal ideation history. So just to kind of look at how participants responded to our questions on how TikTok impacts their mental health, the 3 primary codes that we saw when we coded this qualitative data fell into one of 3 categories. One, TikTok increased their mental health awareness, which about 58% of the sample reported or kind of responded to, and kind of that was the primary code that was given to their response. And then 22% of our responses were primary coded as increased skepticism towards mental health content. And then about 20% were coded as increased utilization of mental health resources. Here are just some representative quotes from those interviews. So to show you kind of the first piece here, which is that misinformation and skepticism piece, I find these quite hopeful in that both of these quotes talked about how the topic of mental health on TikTok can be pretty sketchy. It doesn't really explain how different people are, and it's very generalized, and videos are created by people who are not certified mental health professionals, and sometimes it could be made by high school students, for example. And this is a 21-year-old white non-binary individual with current active SI. We also have the second participant here, who is an American Indian Alaska Native agender individual with current passive suicidal ideation and a history of active suicidal ideation. And they talked about how there's a lot of people spreading information, and there's a lot of mental health TikToks. And so when they want tips on coping, they can find them there. But it's kind of really made them question the validity of some of these TikToks, because a lot of people are kind of talking about how they have multiple personality disorder when only 1% people are supposed to have it. So it's kind of made them more aware and more empathetic, but at the same time also more skeptical, which is really interesting. Some representative quotes on increased awareness. So here we have 2 participants with current SI, either passive or active, talk about how TikTok content has helped them see a lot of different signs of mental disorders, how it's manifested differently in various cultural and gender identities. And so it's been really interesting to hear different stories and different perspectives. And then the second participant here, the 19-year-old white Hispanic male, talked about how sometimes even the comments are very validating. They realize there's other people who are interested in topics like him and also have similar thoughts, which made him feel less alone, which was really interesting. And then some representative quotes on just the increased use of mental health resources. So we see here some participants talking about how there's topics that are kind of delivered to you for dealing with yourself, with others, pointing out issues that you didn't realize were there or that they were actually experiencing. I think this was really interesting. The second quote here, a TikTok filter helped this participant realize that they maybe need therapy. So then it encouraged them to reach out to find a therapist, which was really helpful for them. And then this third participant here, kind of highlighting that sometimes just watching people engage in self-care practices on TikTok has been really helpful for them, reminding them that it's also important for them to engage in self-care and kind of motivating them to engage in some of those behaviors. And then finally, this one last quote that I thought really embodied all three of these themes that we're seeing. So this participant here talked about the misinformation, but also talked about how they increased that TikTok increased their awareness of different mental health disorders and how it shows up for different people, and also kind of learning about the resources that they can use if they were to have a mental health crisis. Now, this was kind of concerning that if you're having a mental health crisis, you can just go to the hospital, probably not the best solution in some of those cases. Because the hospital may not be incredibly helpful. And we know from some of our existing literature that that it could be iatrogenic. But I think what's interesting here is that this information can get through to people on TikTok. And so if we're kind of on TikTok more or on social media more to deliver more accurate or more evidence-based content, it might be kind of taken up by more users. All right. So then asking participants to share their TikTok data, what is that like? So let me first show you what TikTok data files look like. So in R, this is what we're usually looking at. We have participants download what is called a JSON file, which is a huge file with a bunch of lists nested within that file. And within that file, within those lists are nested data frames for each of the different types of activity that folks are engaging in TikTok. And then within each of those data frames, we have basically every single piece of activity for that user since they downloaded TikTok. So for example, if I'm looking at login history and the login history data frame, we have timestamps for every single time that person's logged into TikTok since they downloaded the app, as well as the IP addresses from which they accessed or logged into the app from, as well as the device they used, system they used, and whatnot. So we got a lot of data here. And when participants open this file up on their own, what they're seeing is like a text edit file. So they can still see everything and can edit that file on their own before they kind of zip it up and send it back to us. But they don't have to go through this very complicated nesting situation that we have on R. Instead, they have a more kind of linear text edit file that they can go through. And so before we had participants uploaded their data, we really wanted them to have an idea of what they're sharing with us. So they're not going into this blind and that they can have some agency around what they're sharing with us. And so we went through a very extensive consent process where we walked them through each file that is kind of located in their TikTok file. And then we talked about what we want to do with it. And we gave them some choices in terms of what they would allow us to do with this data. So this is kind of the instructions that we shared with them before we started going through each folder. And we kind of talked about which files we don't need at all that we're planning on just deleting and not even opening, which includes their profile, their direct messages, as well as their shopping folders, which are incredibly private information, and we really just didn't need it for the purposes of the study. All right, so the first first folder we went through was the app settings folder, which is just kind of what settings they use on TikTok, including language, privacy, notifications, and so on and so forth. And as we're kind of going through these slides, something to keep in mind is that this cayenne color, cyan color is the least restrictive option. So this is like, you know, you can do whatever you want with my data. We kind of leave it up to your discretion. Red is kind of a more restrictive option. So we don't want you to see all of it. Please kind of delete the specific links or whatnot. And then black is the most restrictive, which is don't touch this file at all. Just delete it right away for the most cases. So here we can see a lot of folks are pretty permissive around the app settings folder. And then the one we're most interested in looking at was the activity folder. We didn't really care for the favorite effects, sounds, and status and purchases files, so we just deleted those right away. But we asked them about their login history, how much do they want us to take a look at that. You can see here again, folks are generally quite permissive, with a few people having a more restrictive kind of approach. Some folks kind of didn't really want us to use the file and delete it right away. I think that's like one person in this whole study. And then one person said just to delete all the links, but you can kind of keep the timestamps and the counts. We also had searches, so what they searched for on TikTok. Again, a little bit more folks here, and I'll summarize these in a moment. So I'm not going to go through the size of these wedges in detail here. Just wanted you to see kind of what each of these folders were. We also had hashtags, so what hashtags they've used in their post, which links us to all the videos using that hashtag, as well as their favorite hashtags. So that's all in the activities folder. And then we're also interested in the files that talk about how they engage, or that give us data on how they are engaging with TikTok content. And these contain specific links to all of the videos that they have viewed and that they have engaged with. And so one of the options they had were to let us code all of these videos for theme and then kind of delete the links. And that's the most permissive option. A more restrictive option was we can keep the counts and we can keep the timestamps, but we cannot look at the links at all. So they didn't let us see any of the content. And then again, black being don't touch this file at all. And you can see here, again, folks were generally quite permissive. And so we were able to we're able to look at the video browsing data, the likes data, their favorite videos, as well as what they've shared with their friends on TikTok and also outside of the app. Now, the videos file is probably the most private because this is the videos that they've posted onto TikTok. But again, you can see here the majority of participants actually gave us a pretty permissive, we're pretty permissive in terms of what they allowed us to do with this file. And we can view and label their post with a theme before deleting their links. But a larger chunk of folks were not okay with us looking at those videos. And similarly with their comments, these are all of the comments that they've made on different videos. Again, majority of folks being quite permissive here. And then ads and data. So what kind of ads and data, ads they were delivered and whatnot. At the end of this consent process, we asked participants, we gave the participants an opportunity to edit their own data in case they wanted additional privacy here. We have very extensive instructions on how they can edit their files and then rezip it back before uploading their data onto this page. We just asked them to let us know if they made any edits to their data, and 100% of our participants did not touch their data at all. They were like, nope, we trust you. We're just going to upload our data and let you kind of follow our previous instructions on what to delete and what to look at. So just some observations from this process. Most participants gave us a lot of permissions in terms of what we can view, code, and do with their data. But when it comes to the more active behaviors on the app, such as their searches, the comments that they've made, and the videos they've posted, there were a few more people that felt like they needed that to be a bit more private and gave us and selected a more restrictive option in terms of what we can do with their data there. Less active behaviors like the ads that they were seeing, their login history, their sharing. Again, most participants were pretty submissive, but a few more participants but there's some participants who chose the more restrictive options. And then for the more passive behaviors, participants were generally pretty permissive, and not a lot of people had strong feelings around, restricting our access to that data. So then let's look at the quantitative data then. First, I want to look at social connectedness. And by social connectedness, we're really looking at people that the users are following, who's following them, as well as who's following them back. And I'll explain each of these metrics in a second. But we wanted to look at the effect of these social connections on this intensity of their suicidal ideation. And we wanted to see if this relationship was moderated by age and gender. So once we've extracted all of this information from their TikTok data, we first looked at followers. So we can think of followers as people who care about this particular user's content. So these are people who are following the participant. The model was not significant here. Just kind of plotting it out here for you. That slope is very, very tiny, heading in a negative direction, but this model generally was not significant. We then looked at following, which is people that the participant follows. So we can think of this as the amount of people that the user cares about, or with the amount of users that have content that the participant cares about. And here again, our model was not significant, although we do see a slight upwards kind of slope here. But again, not statistically significant. And then we looked at follow back. So this is people who they followed, who also followed them back. And so we saw this as a metric of reciprocity. So reciprocating kind of them caring for each other. And here the model was significant. However, we noticed here that the follow back, what we called the follow back count, was not the predictor that was significant in this model. Instead, what was the significant predictor within this model is age. And so as age increased, we saw an increase in suicidal ideation intensity. And so it's just some thoughts on kind of these findings. Because again, these are really preliminary findings. Our power is quite low. We don't have our full sample yet. But something that we're thinking about is, first of all, after we increase our power, will we see significant results? But also, should we be looking at the network of relationships instead of just kind of these one direction kind of relationships? So should we be looking at all of these combined? Should we be looking at the ratios between who they follow, who they're following, and who follows them back? And so the reason for this ratio being potentially important is, let's say you have a small group of friends, there's only like, I don't know, 5 people that you care about, and you follow them, and none of them follow you back. Is that the same as if you have 50 friends and none of your 50 friends follow you back? And that ratio is something that we're kind of taking into consideration in the next steps to see if that might actually be more important. Because I think if you only care about a small group of people, and that small group of people care about you back, it might not matter how, like, compared to like somebody who has like 5,000 followers, and all those 5,000 people follow them back. Maybe that's the same, or and so we wanted to take a look at some of those ratios as well. The other thing that we haven't looked at yet, because it's kind of more qualitative, is the types of accounts that they follow. So are these folks following mostly friends? Are they following mostly influencers? Are they following other kind of users that they really don't know? And so we wanted to kind of dive deeper into that as well when we think about the social connectedness piece. The next thing we wanted to look at was social engagement. So likes, comments, shares. So how are they engaging with content on the app? Again, looking at the same model here, the relationship between social engagement with suicidal ideation moderated by age and gender. And so here we looked at their past month likes, comments, and shares, just because we have past month SIQ total. And so we just wanted to kind of track it within the same time frame, because some folks may have more likes, comments, shares because they've been on the app longer. So we wanted to narrow that down to kind of what they were doing in the past month. So again, the model between past month likes and SIQ scores was not significant. We see a very, very small downward slope, but not a statistically significant slope. And then looking at commenting on posts, we saw a slight upwards slope here, but again, the model was not statistically significant. And similarly with past month shares, we see a slight upward slope, but again, the model was not statistically significant. And so again, this is kind of our preliminary findings. We don't have our adolescents in the sample quite yet, and we're still collecting data. So maybe increasing our sample size would give us a statistically significant finding. But I also have some thoughts as to why, and maybe it's a good thing that some of these models are not statistically significant. So just some thoughts on next steps we would take to probe this a little bit more. Something we may want to be thinking about, because we're just really scratching the surfaces here with these counts. We could really look at daily averages in the past month. So actually, instead of taking the average from the past month, we could look at just the day-to-day averages over time. So we can look at the stability of their activity. So does the variability in terms of how much they're engaging with the app change? We also could look at activities during periods of higher risk. So like I mentioned earlier, about more than half of our sample have had a lifetime history of active suicidal ideation. And we actually, in our interview, asked participants to give us an idea of when they felt like their period of highest risk was. So they gave us some dates to work with. And so we could go back and look at activities around those dates. And so we can still do that. We can also look at the type of content that they're engaging with. So maybe they're engaging with more kind of mental health related content, or maybe they're engaging with other kind of content. And then again, I think ratios are always interesting to look at because maybe it's that they're engaging with they're going through or doom scrolling and seeing thousands of posts a day and engaging with none of them. Or maybe it's that they're logging onto the app and scrolling through 5 and they engage with each one. So the ratio of engagement may also be interesting to look at here. I think what's encouraging so far, or what kind of the non-significant findings can also tell us, is that suicidal versus non-suicidal adolescents and young adults are not really using the app in very different ways, which might be interesting for us to kind of note, right? I think oftentimes we are really worried about what's going on social media, and that social media behaviors are different for folks who are more at risk than those who are not. But maybe something encouraging for us to be thinking about here is actually it's just the same for everybody. Everybody's kind of engaging in the same ways. But maybe it's the type of content that we really need to be looking out for, or kind of the way folks are consuming the content that's going to be important. So thinking about critical thinking or critical consumption of the content versus just kind of more kind of passive engagement with content. So those are just some of my thoughts from the quantitative results. So with this TikTok ban situation coming up, what does this mean? Does my study still matter? Do we still care? And did I just spend all this time doing something that no longer matters? I think it still matters, because it's possibly could take years for this ban to take effect. But also, young adults and adolescents are fighting pretty hard to keep TikTok around. And because I think a lot of folks see TikTok as an outlet for them to be heard. And a lot of folks are talking about TikTok, how banning TikTok would mean silencing young people and kind of taking away their platform for communication, and kind of voicing their opinions. And so there's a pretty hard fight going up against TikTok. But if TikTok does go away and it's banned, I think something that's important for us to think about is that the content recommendation algorithm is not going away anytime soon. In fact, we have Instagram Reels, we have YouTube Shorts who are trying to replicate the success of TikTok's method of delivering content. And there are many other social media platforms out there that are attempting to take the place of TikTok. So this method of consuming social media is not going away anytime soon. I don't think it's going away ever. So it's here to stay, even if TikTok, specifically that app, is going away. I think it's also important for us to note that content from TikTok is user generated. So if these users can't post their content on TikTok, they're going to find another platform, they're going to find another outlet. And people who want to consume this content, they're going to find a way to access and consume this content. So this problem is not going to go away. Now, I will note that there are some TikTok user guidelines already in place, so things that are allowed and not allowed, as well as interventions that are being implemented by TikTok. So if you were to search suicide, you'll get this cute little picture and some recommendations for calling the crisis text line or calling the 988 and the crisis text line. And also there are some other things that they're doing to kind of improve intervention on TikTok. But I think something that I'm thinking about is that they're not quite good enough because a lot of these are based on keyword searches. And like I said, if people want to see content, they want to post content, they're going to find a way to do it. And so here are just some different keywords that folks have been using on the app to get around blocked keywords for self-injury and self-harm. And I just kind of want to introduce you to this idea of algo speak. And so one of the more popular hashtags is sewer slide because it sounds like suicide. And so let's say this is the root sewer slide, and let's say TikTok catches this keyword. There's still a lot of derivatives using algo speak or what is called coded language or euphemisms on these social media platforms that can get around getting filtered by an algorithm using numbers and symbols as stand-in for letters. Some of us might remember this as leet speak. But there's a gazillion possible derivatives for sewer slide. And so the algorithm just can't catch it all. And so something that we're doing right now in my team, kind of building on this existing TikTok study, is several of my grad students have now gone and signed up for the research API on TikTok. And what they're doing is they're kind of gathering the top used hashtags for suicide and self-harm content on the app, and then coding the types of videos that are qualitatively in terms of the content that's posted under these hashtags. And so we're kind of taking a look at that and doing a deeper dive into that, as well as coding some of the comments that folks leave in the comment sections for these posts. There's also something that another one of my grad students are doing, which is looking at different social media communities, because like I said, social media is pervasive and it's here to stay. And so we wanted to know which communities, how do different communities on social media look at or respond to suicide and suicide related content. And so we're doing a study on that as well. But something that I'm thinking a lot about is we can't really beat them. So all we can really do is learn more about them and join them. We have yet to examine qualitative data from our participants on what acceptable interventions on TikTok or similar apps would be. But something that I'm thinking about is maybe it's the intervention isn't so much about identifying keywords, because again, people will find a way around them, but maybe it's about identifying patterns of use, viewed or engaged content, and changing the algorithm to subtly nudge users towards more helpful content. So if the algorithm detects potential risk, instead of blocking keywords, maybe it's delivering more helpful mental health content. Or maybe it's teaching users or folks who are coming in and working with a clinician, or who are going to a school counselor or a teacher for something that they're struggling with in terms of mental health, or going to their parent for, and teaching them how to change their algorithm so then that way they can see more helpful content and get themselves out of that rabbit hole. Something else that I'm thinking about is we have to better understand why people post sad or suicide related videos on TikTok, right? Again, it's not like there's somebody who's mustache twisting on TikTok and saying, oh, I'm gonna, post this really gory content and whatnot. I think there's some folks like that, but the majority of folks might just be seeking validation or seeking community when they post these really sad things on TikTok. And they're kind of reaching out to other people for help. And I think there's also a reason why people choose to consume this content, right? Because again, you have to engage with the content you want to see in order to start going down that rabbit hole. So why are people going down that rabbit hole? Why are they liking and engaging and viewing that content? Again, are they seeking validation? Are they seeking community? And so I think these are questions that we have to ask in order to figure out what we need to be doing offline to prevent them from going down the TikTok rabbit hole of depressive and suicide related content. Finally, maybe something we want to be doing is trying to figure out how to foster a culture where social media can do more good than harm. I think everybody always likes to talk about just getting rid of social media altogether as a way to improve mental health for adolescents and young adults. But I think that's impossible. It's not going to happen because again, social media is here to stay. And love it, hate it, or fear it, TikTok has changed the way we consume social media content and information. And so I think something we need to do is to look at how we can lean into it and use TikTok as a tool, or these social media platforms as a tool to get helpful mental health content out there. Let me know if you want me to join me on this adventure. We have a lot of data, like I said, to kind of go through. And so always very excited to collaborate. So if you have ideas on how we can look at this data, how to analyze this data, or you want to get involved with some of the projects that we're doing right now, don't hesitate to reach out and we'd be happy to loop you in. Because again, there's just so much data here that we can't just consume it even with my huge team, we can't consume all of it. So yeah. Thank you so much to our funder, the Garvey Institute of Brain Health Solutions, for making this study possible, as well as my co-investigators, Kate and Molly, who really helped us with recruitment and provided some advice on the qualitative questions that we were asking in the design of the study. My study coordinators, all the interviewers who are RAs and graduate students on the team, as well as our consultants, including Dr. Arian, Dr. Cohen, but also all the young adult TikTok users who are related to part of my team or just tangentially kind of related to people in my team. And thank you so much for watching my talk. We're still recruiting. So if you have folks who are interested in, who are 13 to 16 and who might be interested in this study, you can send them this link on this slide or this QR code and have them join our study.